My name is Sarah Georg. I'm a clinical research fellow at the University of Manchester, and I'm interested in rheumatoid arthritis and the risk of heart disease.
I'm Susan Moore. I have rheumatoid arthritis. I've had it for 18 years. I'm a patient at Manchester Infirmary and a member of the research user group at Manchester University. I don't think I was prepared for how it has affected me, and I don't think anybody really understands what rheumatoid arthritis is. I don't think I did either. I mean, lots of people talk about arthritis, and even now today people say to me, oh yes, I've got arthritis in my knee, but it's really not the same thing at all. It just affects everything. Your whole body, your joints, your muscles, what you can do, what you can't do, how long you can do something for. It's quite prohibitive, really. And the pain, well, I just don't know pain like it. It's just unbelievable pain. So I know the medical field often talk about inflammation, and obviously if I've got any swelling anywhere and it's hot or throbbing, then you know that that's inflammation. But sometimes you can get sort of the same sorts of pain, but there doesn't seem to be any swelling. So does that mean I haven't got inflammation then, or?
That's a difficult question to sometimes answer. We know that you can have some inflammation in the joints that causes pain, but that's not caused enough swelling that you're able to see it. Right. So there can be inflammation affecting different parts of your body that you don't feel. So we know in some patients that have pain when they have rheumatoid arthritis, but not a lot of swelling. If we look with an ultrasound machine, we can see a bit of inflammation in the joints.
Ah, right.
And it affects different parts of the bodies too. So we think that there's inflammation sometimes affecting the blood vessels, which can make them, in a way, almost age faster than if you didn't have rheumatoid arthritis.
Yes, some time ago I was asked to go on simvastatin, and I assume that's something to do with the internal inflammation then, is it?
Yeah, that's right. Yeah, that's right. So we know that patients with rheumatoid arthritis have increased risk of having heart problems, more so than people without rheumatoid. Now, it may be partly due to things like cholesterol and diabetes, but we know also that even when you take fully account of them, that actually patients are still at more risk. And we think that the inflammations that you feel in your hands can also affect the blood vessels and accelerate the process called atherosclerosis, which is the leading cause of heart problems.
So your study then is obviously going to involve, is it just rheumatology patients, rheumatoid arthritis patients?
We're actually looking for other patients as well, or people that don't have rheumatoid arthritis. So the way that we've got a number of questions for the study. First of all, we want to know if patients with rheumatoid arthritis have more inflamed blood vessels than other people. So to do that, we're looking for around 80 patients with rheumatoid arthritis and 60 people who don't have rheumatoid arthritis, to see, first of all, do we have any evidence of thickening? And to do that, we use an ultrasound machine, which...
This is both?
Yes,
with and without?
Both with and without. So when we want to look for the patients that have active rheumatoid disease, so they've got plain inflammation in their joints, and then look for people without rheumatoid arthritis. So we're going to screen them with an ultrasound machine that will tell us if there's any thickening or plaque there.
That's that little...
Yeah, that's just a little jelly scan.
Thing.
Yeah. So we do that, and if we do see any thickening, we'll ask them if they'd like to come for an MRI scan and possibly a PET scan as well. And they're the scans that can tell us if there's any inflammation in the blood vessel. Right. So what we want to do is to compare the blood vessels of patients with and without arthritis and see if patients with rheumatoid have actively inflamed blood vessels. And then the second part of the study is in those patients who have active joint disease. Once we've done the first scan, their doctor's going to treat their joints. So hopefully their joints will get better, and we want to then bring them back again and re-scan them and see if we can see when the inflammation's gone down in the joints, has the inflammation also gone down in the blood vessels. And hopefully that will be, it's the first study doing this, so we're not going to answer all the questions with one study, but what we want to see is, can we see the difference between the patients and people without arthritis? Can we detect a change with treatment? And also, these types of scans, are they suitable for patients with rheumatoid arthritis? Because when you've got active joint disease, you're in pain, you get stiff if you sit still for long, and you have to lie for about 40 minutes in the scanner. So
Right.
sometimes that's okay, other times it's not, and there's no point in investing a lot of time and effort in a technique that isn't going to suit patients and that they're not able to tolerate well. So that's another important question. So from that, hopefully we can begin to answer some of the questions. And if it seems like a promising technique that the patients don't mind having done, we can look in bigger studies to understand different types of drugs and maybe over a longer period of time as well. So hopefully it'll lead on to more questions, but also being able to answer the questions better.